Hello viewer, welcome to Health Now Show, your health friend. All matters health. With me, Jane Kariuki, I am a counseling psychologist. My viewer, you remember last episode, we talked about epilepsy and so many things about epilepsy and all the misconceptions in our communities. And I promised that today, the next episode, which is today, we are going to talk about autism. Autism is a condition that has a lot of presentations, a lot of symptoms, and sometimes it's misunderstood. And as I promised, we are going to look at it, and the person to take us through it is Dr. Maureen. You remember? She is a pediatrician, neurologist. She's not new to us now because she was with us last time. And I'll allow her to come in and greet you, and then we can continue with it. Dr. Maureen, karibu sana.
Thank you so much, Jane.
Yes.
I'm very excited that you've invited me again to talk about this very interesting topic about autism.
Yes.
Yes.
All
and,
right.
Thanks again.
Karibu sana.
Asante.
I'm very excited because when we talk about autism or issues to do with children in our communities, we find that sometimes some of these things are misunderstood. And having you with us, talking about children, it really gives me a lot of joy because it is very, very important to pass this information. We say in the show that we are creating awareness in the communities. We are sharing information and sharing information with the people that have it. Because when we have it and we share, then it goes and helps somebody.
True.
And that is why I'm so excited today.
Thank you.
So that we get to the meat of this topic.
Yes.
Autism in children. Kindly define what is autism.
All right. So autism is what we call a neurobehavioral disorder. Yes, it's a neurodevelopmental disorder, and it's characterized by several things. So one of the things is that children with autism, they have something we call issues with social communication. So they're not able to communicate what they need with others. So you will find that actually one of the first things that people see is that the child is unable to, they may have delayed talk and delayed speech.
Okay.
So they talk much later. Or you may notice that, let's say, for instance, a 10-month-old should be able, when you're calling the child, when you say, let's say the name is Mary. Mary, and the child is 10 months, they should be able to look at you. They won't respond, but they'll look at you when you're calling the child. So a child with autism will not be able to do that, will not be able to respond to the name, for most of them anyway. And they're not able to communicate their needs in an effective manner, and they don't have what we call nonverbal communication. So for instance, you've seen a child who is deaf. Yes, a child who is deaf will show you what they want. We'll tell you that, as in, we will not talk, but we'll demonstrate to you that this is what I want. Like if they're hungry, they'll point to the food and things like that. A child who is autistic will not be able to give you that information that by pointing or by indicating. What they may do is that they may take your hand to reach out to that object. So for you, you are the tool to get the object, but for them, they're unable to say, to point to that thing. Yeah. So that's how you can differentiate, let's say the child is not hearing versus the child is autistic, has autistic traits. Also, it is also characterized by what we call restrictive repetitive behavior. So they tend, for those ones who can talk, you may notice that they keep repeating things. Like if you tell them, get for me that book, then they'll say book, book, book. Something we call echolalia. And then they also have some traits that you will notice in terms of how they move, their movements. So they may have things, they may want things to be the same, And they may also have repetitive movements anytime. So for instance, when they're very happy, you may see them flapping their hands and doing things like that. So in broad now, the definition of autism now comes out to be neurodevelopmental condition that is characterized by issues with social communication, so the things that we're talking about, talk and nonverbal communication, and also characterized by repetitive behavior and restrictive behavior. Yes.
So what I'm hearing you say, Daktari, is if a parent sees that the child is holding your hand,
yes,
and taking you to the issue or to the item that they require, you know there's something.
Yes, there could be something. Usually it's a combination of all these three things. So for you to make a diagnosis of, or to say that a child has autism, it has to be, yes, they have that lack of nonverbal communication, whereby they can't be able to tell you what they want, and they can't, even if they can't speak, they can't be able to demonstrate it by using nonverbal cues. Say, for instance, now that we are talking to you, and let's say we are gossiping about somebody who is next to us.
Yes.
Yeah. So I talk to you, and then I say,
you turn your eyes.
Yes, I turn my eyes to that person.
Yes.
You will know that I'm talking about that person. But then a child who has autism will not be able to read those facial expressions, will not be able to understand what's happening. So they won't know that this is a person I want us to talk about, or this is a thing that I want you to get, or anything like that. So that part, plus now the repetitive behavior, like children with autism really like sameness. So they will arrange things in a particular way. They will have, let's say, for some children, they'll want to sleep with the same toy every day. And if you remove it, they'll cause a tantrum. Yeah. So they really want things to be the similar way. They want to eat at the same time, to sleep at the same time, to shower at the same time. If you disrupt that, then they have a meltdown. Yes.
Probably even use the same utensils.
Yes, yes.
If you change,
it will be a problem. So different children have different things that they require to be same. Some children, it will be a particular plate. Some children, it will be a toy. Different children, different things. But then there's always that. And then there's always a thing about the repetitive behavior. Yeah. So remember we mentioned about the flapping of the hands. So if you have that behavior that is restricted, that one that is repetitive, and you have a social communication issue, then in broad now we say you have now autism spectrum disorder.
Okay.
Yes.
And then that's the time that you may require to take the child to a doctor?
Yes, you will definitely require to take your child to a doctor if you notice these things. To be honest, one of the first things that you will notice, it's at around less than 1 year of age. Like the way we've said, if a child is not responding to their name, that is a big issue. Yeah, that's a big thing. A child really should be responding to their name by 9 months. And by responding to their name, what we mean is that the child should be able to look where you're looking, to look at you when you call their name. Yeah. And then the other thing is eye contact. Like now, for instance, when you're talking, I'm looking at you.
Yeah.
But then children who have autism don't have that eye contact. So they tend to avoid eye contact. So they will be looking away when you're talking to them. They may just have just a bit and then look away. But most of the time they will avoid looking somebody in their eyes.
Yeah, and it's not to be confused with shyness?
Yes, it is not. That is true. It is not to be confused with shyness.
Yeah.
Yes. You will notice that very early on. Even, like for a child, babies, when they're small, you hold them, you play with them.
Yeah.
They really should be looking at you in the eyes.
Laughing
with you.
Yeah.
Yes.
Yeah.
So when you smile, they should be able to smile back at you. So these are the things that you will notice, there's something. And if you notice there's something, it's best to get medical advice at that time. And of course, now in the second year of life, you'll notice that the child doesn't have words, or may have words and then, loses a few of the words, or may be repeating words. So if you call the child like Mary, then they also say Mary. You know, you say something, they repeat what you're saying, instead of now giving you feedback such that now we are communicating. I say something, you say something. They usually...
They just repeat what you've said.
They repeat what you said, or they don't say anything.
Oh.
Yeah.
Okay, tuendelee.
Yes.
Yeah.
So, those are the early sort of things that you'll be able to notice in a child who has autism spectrum disorder. There's also the things that you will notice early. So, you know, a 2-year-old really should be playing with their friends, even younger. So if they see toys somewhere and they see like children together, this child should go where they are and do what we call, you know, joint play, where they are playing together. So an autistic child usually will stick away from the group. So that child will want to play by themselves, will not want to play with other people. They have what we call self-play. So when you see, you know, your child really doesn't have eye contact, was not responding to his name, is not really communicating to you the way you would like. So there are some autistic children who actually speak, but then they don't have what we call the back and forth. You know, I speak, you speak.
Yeah.
Yes. They may just be talking. They want a topic, and they will go through that topic.
Peke yao.
Peke yao. So if you want to say, if let's say for instance we're talking about, like now we're talking about autism.
Yeah.
But then now I am fixated. I want to talk about epilepsy. And then we will just go through that talk. You try bring me back, but no, I'm fixated to this topic. Yes.
So you'll really struggle with somebody to bring them back on track.
Yes.
If it is something that you're pursuing.
Yes, that you'll notice that difficulty because they don't have that back to forth. Then the other thing is, you know, let's say for instance when people are when we're talking about something that is together with us, like let's say for instance it's something that's making me happy in this book, and I want to show you that, oh, this picture is making me, you know, this is the thing that I want us to talk about. So that child will not have joint attention. So meaning if I bring that book, you know, to the child, and then like I bring that book to you, then I say, oh, so you will look at this, exactly what you're doing now. Exactly what you're doing.
Like I'm looking at the book.
Yes, you're looking at the book.
Yes.
But then now a child with autism will not be able to enjoy this common thing that I am talking to them about. They will not look at the book. Like, come, let's enjoy this book, let's enjoy these pictures. No, they won't have that joint attention.
I think that is something that really needs to our parents probably to be very keen on that, because sometimes we start giving them books and quite early pictures and all that. So probably you could just look at the camera and tell the parents some of these things.
All right.
Yeah.
So one of the early things in terms of autism is honestly in the first year of life is what we call being able to respond to your name. So if you call a 10-month-old by their name, say the name of the child is called Mary, and then you call them Mary, that 10-month-old may not be able to say yes or respond to you calling them, but they should be able to look at you. Yes. So that's usually a big thing. If the child is avoiding to look at you in the eyes, seems to avoid eye contact, that's also one of the red flags. For the older children, you know, if you notice that your child doesn't really wants to play alone, doesn't want to play with other children, tends to just take their things to themselves, I think you need to just find out what exactly is going on. And it has to be repeated behavior. It's not that they stop playing with people for one time, then you're like, oh, my child has autism. No, it has to be repeated behavior.
Yeah.
And then, of course, the children with autism also have the repetitive restricted behavior, which we will talk more on. But they have, so they may have like flapping of the hands, where when they're very excited, they'll just flap their hands. They may have something called self-stimulatory behavior, whereby they'll just keep rocking like this, and it has to be persistent. They may have something we call visual stimming, where they just keep looking at their hands like that. So if you notice some movements that you really can't understand in the child, I think it's best to just get medical a consultation with a professional to find out what's going on. Yes.
Yeah, I feel, Daktari, that when we are here and in this show, we always talk about when you can go out there and share information. And this, I think, it's very, very critical when we are talking about what it is, because I'm sure there are many other things that come along when somebody has a child like that, and they may not know what is happening. What are these causes of autism?
Right. So autism, usually most of the time we talk about risk factors because usually it's not one particular thing that we can say causes all, is a reason why all children have autism spectrum disorder. So, so for instance, we can go to some of the risk factors. We can start even with the mother.
Okay.
Yeah. So when the mother of the child who has autism, some of the risk factors that may happen even before the child is born. So one of the big things is like hypertension in pregnancy. Yes. So conditions in the mother that may be a predisposing thing is that if they have a complication in their pregnancy, so for instance, if they have specific infections. So if they have infections in pregnancy when they're pregnant with the baby, then they may be predisposed to having a child who has autism. If they have hypertension, they have a higher chance of having a child who has autism. That's why it's important to make sure...
You can see the way I'm looking at you.
Yes. It's important to make sure that they follow up with their obstetrician so that all these conditions can be managed so that they don't increase the risk of having a child who is autistic. Another thing is late age in the mother having a child. Let me put it in another way. So if you're past the age of 40, then you're at a higher risk of having a child who has autism. If the father is also older, so for most studies it has shown that if fathers are above the age of 50, then they have a higher risk of having a child who is autistic. So those are some of the maternal factors. If a child is born premature, so if prematurity is also an independent risk factor for having a child who is autistic. So for the parent, for the mother, she really has to follow up with the ANC visits, the antenatal visits, so that they make sure that if she has an infection, if she has a risk factor, if she's hypertensive, then that is managed. If there is anything that may cause her or increase her risk of having a child who is premature, then to make sure that that risk is mitigated, because if they get a premature child, they have a high chance. And that chance in the premature child is increased the younger the child is in terms of gestational age. So, of course, a child who is less than 32 weeks in terms of when they are born versus a child who is 34, 36 weeks has a higher chance of having autism when they are born. We also have some medical conditions in the child that increases the risk of autism. So, for instance, there's a condition called Fragile X that's found in boys. And then now for these conditions, you have actually to seek medical diagnosis, medical care, have a professional do a consultation, because you have to make sure that none of these medical conditions are the things that are giving you this autism or giving you autistic features. Because it would be quite sad if a child has a medical condition that is the one that's giving these features of autism, and it's a condition that can be managed. So this is where now epilepsy and autism come together, because there are some conditions that cause, medical conditions that cause both autism and epilepsy. So especially if a child has autism and epilepsy, it is very important to go for a consultation so that we can be able to find out, is there one medical condition that is explaining these two things? Yes. So I'll just mention also there's tuberous sclerosis, also a medical condition. There are also other metabolic conditions that present with autistic features. We talked about metabolic conditions when we're talking about epilepsy. So these are some of the things that are risk factors for a child to have autism. Then a big one is genetics. Yeah. So if you have a child who has autism, then you have an added chance of having another child who has autism. Yeah. Yes, because genes, genes, there's a hereditary feature to genetics. Yes, it could be that that's the only child, to be honest, because maybe it is that child's genetics that has predisposed him or her to having autism. But then there's also the one where it runs in families, where you'll find, the aunt, they had a child, and then now the other one had a child, and they all have autism. So that is also a very big thing, yes, in terms of genetics. Right. So we also have structural conditions that are predisposed to autism. So if you have, if you say, for instance, if you had meningitis, yeah, when the child was younger, got meningitis, and then caused a particular injury in the brain, then that child could also have autism spectrum disorder. If they had, let's say, a tumor in the brain, and then they could also have those features of autism, even after it's corrected. There are also some specific conditions, like the way we'd mentioned about tuberous sclerosis, that are in the brain that also give you features of autism. Yes. So in terms of the causes, or let's say risk factors of autism, we can also divide them in the same way. So we can say the structural causes in the brain, metabolic conditions, and then we can also talk about, pregnancy and the risk factors in the mother, genetic conditions, and medical conditions now in the child can also be a major thing in terms of autism. Now, one of the big things is, as we said, is autism and epilepsy.
Yes.
Yes.
Yeah.
So autism and epilepsy also share genetics. There are some genes that are specific to both conditions. So that's why we say if the child has autism, it's very important that we make sure, even in the history, in how the patient presents, we make sure that the child doesn't have epilepsy, because those things usually are very closely related. Because, in a child who has autism, they have a 20 to 30% chance of having epilepsy. And a child who has epilepsy has an even greater chance of 30% of having autism.
So when one is discovered or diagnosed, then it is also very important that the other one is checked.
Yes.
So that when treatment is or management is going on, you're complete in
Very
terms
true.
of taking care of both, if both are there.
Yes.
But there could be, I guess, some situations where it is one that is there.
Yes.
But in the event that both are there, then
Yes.
the child will be helped better.
Yes.
Okay.
That is very, very true. That's why we actually advocate for people to go for to be checked whether they have, to go to a medical professional to have that diagnosis, and to make sure there are no comorbidities.
Yeah.
So other than epilepsy, autistic children usually have intellectual disability. Not all children, so some children. So you'll find that about maybe 25% will have intellectual disability. And then you will have 30% who will have, who usually are called high functioning. They're the children who will be geniuses, for lack of a better word.
Yeah.
Yes,
Okay.
in specific things. So they are very, very good at specific subjects. So you may have somebody who's really good in IT, somebody who's really good in computers, somebody who's really good in one subject, yes, or mathematics, or playing the piano. So we also have that group of children who don't have intellectual disability, are now on the high functioning part, the high functioning group.
Kind of an extreme,
Yes.
like polarities.
Yes, the extreme polarities.
Yeah.
Yes, one will be really, really good. But then we have to realize that because 25% will have intellectual disability, they also have to be assessed, because intellectual disability that child has to be supported. So we have to make sure that child, if they get the proper follow-up. Another comorbidity is depression. So these are children like any other children.
Yeah.
So they get depressed, You know, they have this thing, they want to tell you something, they can't be able to communicate to you. The only issue is that their world is very different from the way we perceive it. Yes, they are seeing things and feeling things differently. So the inability to understand the world the way we understand it, or to communicate what they're feeling to you as a guardian, makes them at a higher risk of having depression, of having anxiety, all these disorders that usually are in the psychiatrist domain. So for us, what we do is to make sure that these children don't have these conditions. And if they do, we find out early and then manage them early. Yeah. They also have other medical conditions. They may have constipation, diarrhea at a higher rate because they have issues with taste perception. They may have problems. Sometimes they don't. In terms of taste, they may not like what is sugary things or salty things. They may be perceiving taste in a different way. So they may refuse to eat. You refuse to eat, or you eat just specific types of food because of how they feel in your mouth, then you end up being constipated.
Wow.
Yeah. And then, so some of these things these medical conditions, like even sleep disorders. You may find like children who have autism may be unable to sleep at night. The mother is frustrated because the child is not sleeping at night, wants to stay the whole night up. So if there are these conditions, for sure we're going to manage them. And that's why it's important to come in.
Yeah.
Also, aggressiveness is a big one. Yeah, the child, because of the frustrations of what they're feeling, they're not able to express it, they become aggressive. So you will hear the mom, it has been called to school today, tomorrow, the next day, oh, your child has beat another child. Your child outside has done this to somebody else's things, you know. So for those children, we also find a way of managing them. We can either do with the very modes of management, which we will talk about as we go along, but we can be able to help that child so that we can make sure that that child is not aggressive. Yes.
Okay. Well,
yeah.
I've heard, Daktari, that boys
yes.
are more prone, for lack of a better word, to autism than girls. Is that a myth?
That is a myth. That is a myth.
That is what I've heard in the community.
Yes. Actually, the misconception is that only boys get autism. That's one I heard. Yes,
I heard that more boys get autism than
that's
girls.
True.
Yeah.
That's true.
Yeah.
So in terms of the prevalence of autism, more boys definitely have autism than the number of girls who have autism. But usually, it's not that girls can't get autism.
Yeah.
Girls are very good at hiding their autism.
Oh.
Yes. So it is easier to diagnose autism in a boy than it is to diagnose autism in a girl, because the girl finds coping mechanisms. Yeah. Girls are stronger at birth. Okay. Girls are stronger. It's known that, that is the case. So now, in terms of even finding coping mechanisms of dealing with what others may perceive as their weakness, say for instance, in terms of social communication, girls may find other ways of dealing with that, such that you're thinking that your child is, fine because they're communicating to you, they're talking, they've gone that extra mile and they're able to talk to you. But now, if you look at the content of what they're saying, that's how now you'll be able to diagnose it. Yes. So you may be able to have a conversation with them, but then they will stick to their topic. It won't be let's talk together. Yes. And say, for instance, now maybe for the autistic boy, they will now avoid you completely, not want to talk to you completely.
Then I think the boy would be better in terms of help.
Yes.
Because the girl, if you're hiding, it may take longer for the parent or the caregiver to identify what is going on.
That is true.
So it will be a disadvantage to the child.
That is so
to
true.
The girl.
That is very, very true. It's a disadvantage to girls because now, autism is a lifelong condition. So despite the fact that, let's say, you've not diagnosed it when the child is younger, you will see these issues come up in adulthood. So for the girls, the unfortunate thing is if you're not found, you're not diagnosed and given help, then that issue will come up later in your adult life, that now people will be like, there's something. We can't put our finger on it, but there's something. Yes, so for you to live your full life, it is important that you're diagnosed, your child is diagnosed, to be able to, live with the condition.
Early enough.
Yes.
Early enough.
Yes.
You talked about months.
Yes, months. In months you can tell.
Yes.
Yes.
Tuendelee.
Right. So the good thing about getting an early diagnosis is usually you're able to get all the interventions that are necessary. So we've said all these comorbidities of autism, they're able to be managed. The aggressiveness, the constipation that comes, all these things can be able to be, a healthcare professional will be able to tell you, okay, so this we can manage the lack of sleep, lack of social interactions, finding ways to counteract those behaviors. So for sure, the earlier you know, the better it is. Yes.
Wow. Viewers, I'm sure you are learning as I am. And this is just going to be part 1, because we are yet to go through the next one. And we are going to look at more of the symptoms, and we are also going to look at how do we manage and some of the misconceptions that come in our communities. And I'm also still requesting you that you get to our Facebook and YouTube Health Now show, and just give us this feedback. Tell us, what is your experience with an autistic child, or what have you observed and you cannot understand? And as the doctor is talking, you are saying, yes, my child has been behaving like that. My child does not look at me straight. My child is repetitive. So continue writing to us and giving us this feedback, and I believe that it will be help, because as we say, and I keep repeating this, is that we are here to share information, to sensitize you as our viewer, to sensitize you and share information with you as our community, so that we can live healthier and better lives. And we'll stop that for this part, and then when we return, we'll come to do the second part on what we are talking about, autism in children. Bye for now.